Patients who are a good candidate for jawline filler are typically those who do not already have a strong angle of their mandible, or soap opera jaw as we call it, with a nice prominent area back here. People who desire that often find that when we do jawline filler, it helps to give them a more sculpted look, gives them a little bit more of a model look. If they have loose skin here in the jowl area, increasing the volume here can help to pull that skin back and give them a more youthful appearance. Also, having a strong angle of the mandible and a strong jawline gives the illusion that you're thinner. So some people really like that look, because if you ever look at models, they tend to have really strong jaws. Also, if there's any looseness under the chin here, filling the angle of the mandible with jawline filler can help to pull that skin up and give a more youthful appearance to the neck. The filler I typically recommend to enhance the jawline is one made by a company called MERS. It's called Radiesse. It's a calcium hydroxyapatite gel. So considering bone also has calcium in it, this gel filler is the most similar in structure to our existing bone. Other products can be used, such as the hyaluronic acid fillers. Those typically can be dissolved, so if someone doesn't like the results, you're not in a situation where you're stuck with an unhappy patient, because you can always reverse the effects. The way we would determine how much volume to use in filler to create jawline enhancement is based on several factors. Number one, how weak the patient's jaw is to begin with. If they already have a slight angle and they just want to enhance what they already have, then it doesn't require many syringes. However, if someone has a flush jaw where there's just no definition, you'll require more syringes than if they already have some structure there. Also, depending on how much of an improvement someone wants will affect how much filler that they end up getting, and also how much money that they want to spend. The only risk or side effect that I've seen with jawline filler was in one patient. They had a headache which lasted about a week. This was very unusual. Most people, the only side effect they have is wanting more. So it's not typically a procedure where there's much downtime. Sometimes the patients have a little bit of soreness in this area, and chewing is a little bit tender for about a day, but otherwise it's typically a procedure that does not have a lot of side effects. Filler can be reversed if we decide to use a hyaluronic acid filler, such as Restylane. We would typically want to ask the patient if they have any concerns in advance, because if we don't use that filler and use Radiesse, the Radiesse cannot be reversed. So if someone is going into the procedure and just sort of not entirely sure that they're going to like the results, they should definitely ask for a hyaluronic acid filler, such as Restylane or Juvederm Ultra Plus, because that can be dissolved. The Radiesse cannot be dissolved. So the jawline filler typically lasts up to 9 months. It can vary depending on the metabolism of the patient. Patients with a faster metabolism, it may not last quite as long. The great thing about Radiesse is that it actually stimulates collagen production, so you're going to have some long-term volumization and enhancement of that area because of the collagen that's produced by the Radiesse. So it's definitely a procedure that people are coming in, typically about every 9 months to get it touched up, because typically after they've done it, they really like it.